Arroyo Center, and a senior political scientist at the RAND Corporation. So we have a great topic for everyone today. It's a very broad topic, so there's a lot for us to go through. We'll be talking about disinformation, public health, and public opinion. I'm going to go ahead and kick things off with a kind of a question for each of the panelists, and then we can get into more of a discussion later on. But I kind of want to go through it and hear a little bit about the work that everyone has been doing over the course of the last year. So I think we'll start with Ashley. So Ashley, you work at KFF, an organization that is very much oriented around public health. So you will be the person on this conversation that I will go to with all of the public health themed questions first. But for anyone who doesn't know your work well, can you walk us through your polling efforts and also maybe differentiate between what would you do in a typical pre-COVID year and what you've done differently in 2020, 2021?
Thanks, Laura. Yeah, and so I think something just happened with my Zoom. I ended up having to join in Zoom instead of it through the Whova app. So hopefully everyone can see me, and my screen went black in the Whova app. So here I am. Hopefully. Okay. Yeah, and thank you, Erin, and thank you, Laura. It's been a wonderful virtual conference so far. So yes, at KFF, we are always tracking and providing public opinion data, including attitudes and experiences on the country's biggest public health story. In previous years, this has ranged from expanding coverage under the Affordable Care Act to experiences with climate change. And in 2020, the biggest public health story was also the biggest story with the coronavirus pandemic. At the beginning, we stuck with our normal strategy with conducting high quality, probability-based polling released for public use for policymakers, journalists, academics, and others so that they have timely data on this story. And we quickly learned in our polling that the pandemic was having a disproportionate toll on some of the country's most disadvantaged populations. This, in addition to our initial vaccine intention data, which we started collecting before the vaccines were made publicly available, we saw some indication that certain populations may have different and legitimate questions and concerns about the safety of the vaccine. And so both of those combined made us very cognizant to think about the representativeness of our samples. So what did we do differently? We did a couple of things differently. I'm going to start with the methodology that we did. We expanded our sampling of pay-as-you-go phone numbers to reach younger Hispanic and Black respondents, as well as those with lower incomes. We increased our samples of Black and Hispanic adults in our polling beyond what you would normally get in a traditional representative poll. And then in addition, we also built a dashboard, which was very different for us, and Grace linked to during her presentation. But what we wanted was a place where all of the most recent data from our vaccine monitor could be aggregated in one place with shareable graphics for use on social media and other materials so that people had a resource to go to on the most recent data publicly available from KFF. So we altered our methodology, we altered how we distributed the information, and we got to work. We started collecting data throughout the pandemic. We've been in the field almost every month. And so we've been hard at work at really tracking the public's experiences with the pandemic generally and the vaccines.
Okay, thank you for that introduction. I'm going to kick it over to Jennifer now. Jennifer, as I mentioned in the introduction, you are responsible for leading lots of different projects at RAND, one of which that I want to kind of focus on today is RAND's Truth Decay report. I will provide a link to that in the chat for everyone, but I was wondering if you could kind of give us a brief overview of your polling efforts at RAND.
Sure. The Truth Decay effort is something that we actually started in 2015, so it's something that well predates COVID. And we define truth decay as the diminishing role that facts, data, and analysis increasingly play in political and civil discourse and in the policymaking process. So this is similar to what other organizations might have termed like post-truth politics, or some people talk about as fake news, but it's really it's broader than that. One thing that's unique about our effort is that we've really approached the challenge of disinformation, misinformation, from a holistic perspective. So while the disinformation, the misinformation, changes in the information environment are one set of factors and drivers that we look at, we're also really concerned with other elements of the problem. For example, cognitive biases, just the way we process information that makes humans more susceptible to false information, to clinging to that information once they believe it. It's a huge piece of the problem that isn't necessarily related in a direct way to the changes, the technological changes or the economic changes that we've seen in the media environment. We're also thinking about the political context. Polarization, both in the political spectrum, as well as economic inequality and demographic polarization, or like the big sword phenomena in which, we end up living in communities that are very similar to us, but very different from sometimes very nearby communities. In these kind of insular communities, alternative narratives can thrive really easily. So we think about all of these processes as interconnected, and then related again, in addition to the education space, media literacy, civic education, and the way in which these types of literacies provide resilience or to disinformation. One of the factors that we've looked at is the ways in which our current education system, even though it's adapting to the way that the information environment has changed, it can't adapt as quickly as the information environment itself is evolving. And as a result, there's this gap between the skills people have and the skills they need. And so it's really that gap where we're focusing our policy efforts. In terms of thinking about polling and public opinion, we want to understand, on the one hand, how people are using information, how they're experiencing the information environment, what their levels of trust are. On the other hand, we're interested in talking to teachers. So we also at RAND have the American Educator panels that focus on what teachers are actually providing students in schools. That piece of the project allows us to understand what is happening in terms of civic literacy, what resources do teachers have for media literacy. And so we're able to come at the problem from multiple different perspectives, to really focus in on the ways in which the use, the understanding, and the uptake of factual information is changing, and what that means for public health, what that means for the political spectrum and elections and voting, and what it means for a whole range of other issues. So we published this first report in 2018. Since then, we've probably published 15 or 16 additional reports that try to dig into pieces of this problem. During 2020, we focused on two major issues. One obviously being COVID and COVID disinformation, looking at sources, narratives, target audiences, and how that changed over the course of the year into 2021. And then elections, how the election, the actual execution of election changed as a result of COVID, but also how people felt towards elections. Disinformation around election integrity, trust of elections, and questions like that.
I think we may have Laura may have frozen, or she's just deep in thought, probably frozen. But Bree, if you wouldn't mind going next, giving us your intro, that'd be great. Thanks.
Sure thing. So I was staring at Laura, and I'm like, I can't quite tell if she's like really thinking about what Jennifer is saying. Happy to answer the next set of questions, and thinking about how our approach has changed over the last couple of years at the Center for the Study of Los Angeles. And for us, it was a couple of main points. One of them was the speed at which we were doing surveys all of a sudden. For example, typically we would have several months to put together our survey questions and really kind of work and figure out what was going to be the best strategy. And then right after COVID hit, we were approached by the mayor of the city of Los Angeles, Mayor Eric Garcetti, and he asked, how quickly can you do a survey? We said, well, it takes us a couple weeks for writing and then translating and programming. And said, can you be in the field in 2 weeks? Like, I'm sorry, I don't think I heard that correctly. That's how long we would take just to do one component. But he's like, no, I need to find out. I need to find out what's going on with Angelenos as quickly as possible. And it was a really great exercise for our team to kind of have this very much of an all hands on deck. We typically kind of have like this person is focused on this or this person on this. We were all working on the project, all of us just working as quickly as possible. Thankfully, we have great partners with the ISA group. I think Francine is on here as well. So we're able to move forward very quickly, but we've also been able to do some of our other surveys very quickly, but without losing the rigor of the actual survey writing question. One of the other things that we kind of changed and transitioned, we're now doing face-to-face surveys, which we had done things like exit polls before, which were obviously face-to-face, but typically not for our survey of residents. So that was a new element that we added, which was a curious thing to add during a time of COVID when you're trying to be mindful of your interactions with people. But really seeing that we need to be speaking to populations that we were previously excluding, certainly not intentionally by any means, but really understanding that we need to kind of up our efforts to speak to as representative of a population of Angelenos as possible. And we also saw that thankfully we were getting a little better response rates while everybody was home during COVID, but also that people were taking a lot longer to answer our well thought out, quickly worded multiple choice question. They were not just giving a simple answer and kind of moving on. They had more dialogue. They wanted to discuss. They wanted to not just give an answer or say like, I strongly agree because. So we needed to adapt some of our survey questions to allow for more context and more discussion, because we didn't want to be off-putting to the respondents and have them feel like we were just kind of brushing them off and moving on to the next topic. So those were kind of the three main areas where we really saw our polling change and evolve for the better as we think back through COVID.
Thank you, Bree. Sorry, I dropped off unexpectedly, but I recovered. So thank you for carrying on without me. And thank you everyone for kind of walking us through all of your research so far this year. Just for everyone's benefit, we have, three great panelists here to talk about their work specifically as it relates to disinformation, public health, and public opinion polling. So kind of with that framework in mind, I'll kind of go through, a discussion that we've had. We've talked a little bit about just amongst the four of us so far, but we want to have time for questions from the audience at the end. So feel free to leave any questions in the chat and I'll see if I can pepper them in throughout. And then we'll also have time for true questions at the end of the conversation. But kind of the next topic of conversation that we wanted to go through was just, this was such a crazy year following another crazy year. So what are kind of some of the big surprises that you've seen in your polling and public opinion research recently, specifically anything related to disinformation, misinformation, and the way that the public health kind of consequences that we've had to face the past year have affected public opinion polling. Anyone want to jump in with a key finding to start?
I can start. That's fine. We're not going to keep going in order. This is the last time I'm starting, but yeah. So yeah, key findings. So I mean, we just released a poll today, right? That shows that optimism about the status of COVID-19 vaccinations is down, frustration is up. We launched our vaccine monitor a year ago, and did I think that a year later we would still be looking at the share of the population who says they will definitely not get a COVID-19 vaccine and the reasons behind that, and trying to understand what's driving that resistance to the vaccine? Probably not. I think we knew that there would be some initial skepticism and concerns, and public health officials would have to address that. But I don't, we knew that there was some partisanship that was going to be driving that, after the election of President Biden. But I don't think we saw or we anticipated the really hardline skepticism, especially among Republicans. And so that was one of the biggest stories. You know, it's hard to like even predict what's going to happen next month. We're facing a new variant. We don't know if that's going to result in more masks mandates or, more employers imposing vaccine mandates and how that may change attitudes and experiences. And so it's really hard to predict, even month to month, like what we're going to be asking about, what the environment's going to be. You'll see a bunch of us are at work today, whether we're going to be working at home or working back in the offices. So I think, being really flexible is one of the big lessons that we've learned, both in our research and our work environments. And so, yeah, that's, I'll stop there and let others chime in.
Yeah, I think just piggybacking on that, Ashley, the work environment, if you had said 2 years ago, how would your research center do if you were working remotely? It would have been like, oh, yeah, I don't think that would work. I'm not sure. And then even when we did go home, we thought, oh, things are going to be kind of slow. People probably are not, they're just probably going to pause on a lot of things. And we certainly had our busiest year at the time last year, and then 2021 is slated to be even busier. And now figuring out, like, I know everybody uses the phrase, the new normal. But it's like the new normal is very flexible. And it's like, I keep wanting to have parameters around it. And it's like, it's a parameterless new normal, which is a fun challenge. There's just a lot of things that's like, oh, I keep thinking once we get on the other side, then, what will things go back to? And it's like, I don't think there is an other side. This is just something that is part of the future of what we're going to be doing.
So I guess I would say the thing that surprised me the most, in our first Truth Decay book, we did some historical analogs where we looked at periods of time in U.S. history that were similar to today in terms of the spread of disinformation, political polarization, changes in the information environment that led to the spread of exaggerated news stories or changes in the way news was consumed. And in all of them, there was some kind of event that triggered a reversal. And usually that was, like a war or the Great Depression or something that like really changed the way people thought or changed the relationship between people and information, either raising the importance of factual information or something else. And so when we thought about the future, and this was like in 2016, and people would ask me, well, what's going to change this? And I would think, well, gosh, I hope it's not like a catastrophe, and then when the pandemic happened, I thought, well, maybe this will be it. Like maybe people will see that, science is so powerful and numbers and facts are so powerful because they'll help us make trade-offs between economic costs and public health. And, following scientific guidelines will help states kind of weather this, the challenge and help people keep themselves safe. And we'll see the power of vaccines. And then the opposite happened. It seems like it got even worse. Like disinformation became worse. Partisanship around the virus like rapidly escalated and around vaccines, so that now like the biggest predictor of whether or not someone has gotten the vaccine or is a vaccine skeptic is partisanship, which wasn't the case in terms of thinking about anti-vax sentiment before the pandemic. Before the pandemic, vaccine skepticism was one of the best examples of like a bipartisan rejection of facts, because there were anti-vaxxers on the left and there were anti-vaxxers on the right. And now that story has changed. So sort of like the pattern that I thought we might see turned out to be kind of totally wrong. And, I have theories about why that may have been. For example, like the fact that we do live in such a kind of balkanized society means that everyone's experience was radically different. Like some people were able to work at home, some people weren't. Some people had really high virus case rates in the first month, some people had nothing. That meant that that people actually experienced different things and learned different lessons. And obviously the partisanship and polarization, whether there's a significant debate among political scientists about like how bad is polarization. But I think we can all agree that like at least the affective polarization, like this sense that like I hate the other side, is pretty severe, whether or not ideologically we're all that different when we cut down to major issues. So for me, that was sort of like a huge and disappointing surprise. but I think underscores some of the unique characteristics of the period that we live in now.
Jennifer, I remember when we talked earlier, one thing that you brought up was education, and how education used to be such a big driver, or typically is such a big driver in a lot of different public opinion data, and increasingly, kind of as you were just saying, that doesn't prevent people from, their education level doesn't prevent them from, not believing what they see on the news, or falling prey essentially to disinformation. I'm wondering if you can speak a little bit about that in terms of the research that you might have done.
Yeah, I mean, I think before the pandemic, we had this finding that, isn't unique to RAND's work, that education isn't really a good predictor of resilience to disinformation, that people who have PhDs are often the most vulnerable because they kind of believe that they're smart, and therefore if they believe something, they cling to that belief and are hard to dissuade or hard to change their minds. And I think you saw that in the context of the pandemic, where people who are very smart and have advanced degrees in some subject that may really struggle with COVID disinformation and misinformation, and may struggle to disentangle like what's a good narrative versus kind of false information, whether it's about the virus itself or about vaccines. And so I think that this was kind of like a real world example of a lot of these trends that we saw in the data. And something that, still, even though I knew the data, it was still surprising to see people that I consider to be very smart telling me, oh yeah, no, the vaccine's not safe, it's going to cause X, Y, and Z side effects, when, that was not my interpretation of the data, nor was it the interpretation of most, scientists and doctors. So.
Mm-hmm. Ashley, I have a question for you on this, and something that I've thought about with the KFF data a lot is that I think you've had research on medical professionals, on healthcare professionals, and how even among that population that is constantly exposed to coronavirus and to all of the threats that come along with it, there's still a significant group that are not willing to get vaccinated, or who don't believe in the data. Wonder if you can talk about that a little bit.
Yeah, that was one of the interesting projects we did this year, and we were looking at healthcare workers, and we really wanted to make sure when we were talking about healthcare workers, we weren't just talking about doctors and nurses with an advanced degree. We were talking about the full spectrum of people that work in the healthcare sector, because all of these individuals are being faced with the coronavirus, right? And so we were trying to understand, these were the populations that were first eligible to receive a vaccine. And so understanding their attitudes towards the vaccine. And what we found is, not surprising now, because we know that, healthcare workers are representative of the population. They are our neighbors. They have the same concerns and questions. They have the same partisanship. They have the same political leanings and ideology, and they're still susceptible to misinformation. And so we know that there was initially some hesitancy among healthcare workers about the vaccine, and it really mirrored what we saw with the population generally, right? So those in the Black and Hispanic community, initially, I think we all know that they were among the populations that were in that wait and see category. So they weren't the most vaccine resistant. They really just wanted to wait and talk to a healthcare provider, or see what happens with their friends and families as they get vaccinated. And that was true among healthcare workers too. And so, yeah, that was one of those unique pieces of data that I think really illustrated what we were going to see with the population writ large when it came to vaccine rollout.
How much, the three of you, I think one thing that we talked about earlier was everyone has kind of had to become an expert in public health over the course of the past year. Something, Bree, that we talked about earlier too, is that we all had to get comfortable polling on topics related to race relations and, election polling, of course, but like what are some of the ways that you've incorporated, disinformation, or kind of teasing out trust in the media, or where people are getting their information from as you're trying to poll on all of these different topics over the course of the past couple of years?
First of all, it's nice to see, Ashley, that you have sunshine. I get that same, the ray of sun coming in, and it's a super cloudy day out here in LA. So I'm jealous for your sunshine. Soak it up while you can. Yes, that's certainly been the case. We have done a number of studies at the Center for the Study of Los Angeles looking at race relations over the years. And typically when we're having conversations, we're very matter of fact. You know, this is the breakdown with, you know, different groups that that identify with certain racial and ethnic groups. But when it came to topics of COVID, we knew that we needed to be very mindful, because how we were explaining the data or how we were representing it could have more implications than just a simple conversation about race relations. I say that in jest. I know that's a very weighted conversation, but now adding COVID was this whole other layer that we were not used to having before. So when we're discussing about, you know, how different racial and ethnic groups are getting along, that's one thing. But now when we're saying that that certain groups say that they're not as likely to get the vaccine, we want to be so careful that we are not adding to that, or we are not exacerbating the issue and saying that, you know, well, this group is more hesitant. We understand why. There's a lot of literature on historical experiences. We very much understand why there may be that hesitancy and lack of trust. But what if something that we say, or the way we say it, what if that makes the situation worse, or makes people less likely to get the vaccine? So we were extremely cautious, and that was something we were really kind of concerned about. One of the actually, I'll pause there and then let others speak as well.
Yeah, I think I just want to tag on to Bree, and I appreciate you acknowledging my son issue. I'm struggling over here, but you know, we all know about social determinants of health, right? And the reason why certain populations and have different experiences with the healthcare system and public health. And so really acknowledging that in our polling research and speaking to that and not placing blame is a huge part of this research, right? To really examine the reasons behind people's attitudes. And, you know, one of the things that we found is that certain populations also weren't just getting the time off work to get vaccinated. That was also true in the healthcare worker study. You know, we found that if an employer was offering the vaccine at their place of employment, they were way more likely to say that they have gotten vaccinated because they didn't have to take time off work. You know, a sample of within these healthcare workers were home healthcare workers, right? So they're in patients' home, they're not going to a physical healthcare setting. And so these populations may be working multiple jobs. And so they may not have the time to get off work, not only to get vaccinated, but also to deal with whatever side effects they may be experiencing due to the vaccine. And so really, you know, calling attention to that so that we're not placing blame on populations was a real important part of this.
Well, you know, I'm really lucky at RAND because, you know, RAND is a really diverse organization. And so we have people who are experts in everything. You name it, there's somebody at RAND who's an expert in it. And so I think, you know, one thing that we've been really focused on over the past couple of years is making sure that our teams have the right types of expertise. So, you know, we have people at RAND who are infectious disease experts and who work part-time at RAND and part-time at major hospitals in you know, Boston and other cities. So getting them involved in our projects and having their input into how we ask questions and how we think about these issues has been really important. When we're thinking about disinformation, you know, RAND has a very robust national security program. So we do a lot of work focused on disinformation coming from Russia and China. We have experts who, you know, are Russian native speakers and who speak Chinese, you know, at native level of proficiency as well. So we're able to take advantage of that. And then, you know, the race and ethnicity piece, again, is hugely important and something that I think, you know, we've seen it play out in our research and that we really want to focus in and make sure that we're thinking about how different narratives affect different communities. when we're thinking about disinformation, I mean, one of the ways in which Russia especially is effective with their disinformation narratives, whether it's around COVID or something else, is identifying areas where Americans are divided and sensitive issues. So they play on things like Black Lives Matter. They play on these narratives of racial grievance, and they play on these types of issues that are highly polarized and highly politicized. And so understanding the social and political context within the United States is hugely important to understanding how where disinformation gets its power. Disinformation by itself is dangerous, but it's sort of disembodied. If we had a resilient, cohesive society, we might be better able to absorb disinformation, identify it as such, and kind of discard it. But because we are so divided, all these fault lines, whether it's around race or party or something else, become highly vulnerable sites and targets for Russia and then China, because China's approach in the information space has basically been to mimic the tactics used by Russia, just amplifying those patterns even further. And so I think those are ways in which some of these public health and racial equity issues have refracted into our research on truth decay.
Yeah, I think a question for the three of you is kind of that I've been mulling over throughout this conversation is kind of, has kind of the purpose of your research changed over the course of the past couple of years? Have you been trying to do more, polling that will be more advocacy focused rather than just getting the data out there? Or has the way that you've seen your responsibility as a public opinion researcher changed in any sense? I don't know, so it's kind of a toss-up question, if anyone is willing to take it.
For us, our tagline, if you will, has always been research, action, justice. But I think whether or not we kind of have that at the front and center of all of our research projects, I mean, sometimes it's like, oh, we're doing something completely unrelated, and I think just in the last couple of years, there's been more of an emphasis on, every single one of our research projects has the action and justice component. Sometimes it's going to be stronger than others. Sometimes it's not us doing the next two steps if we're working with a client and passing that along. But really being mindful that it's not that certain projects have a research, action, justice focus and others do not, but really seeing that each and every one of them do. And if we're not noticing it right away, we need to look more closely because it's certainly there. And then how do we explain that? We are a primarily undergraduate university. So how do we teach our students to understand that connection and how they can be agents for change with that data?
So RAND doesn't do advocacy, as a nonprofit, and we have a federally funded research and development centers. We have lots of rules around what we can and cannot do, but I do think that attending to racial equity has become a bigger focus, not just within the Truth Decay initiative, but within RAND more generally. So within the Truth Decay portfolio of projects, we've started, a kind of a new stream of research focused specifically on understanding the intersection between race and truth decay, and how truth decay, as we've defined it in the first book, may mean something very different depending on your background and your race and ethnicity, your social class, things like that. So trying to really tease out that piece of the phenomena and make sure that we're attending to it with enough detail. And then of course, all of our polls are broken down by demographically so that we can understand and identify these differences. And that then leads to other sets of questions. So I would say that I think that definitely it's become a bigger focus in our projects, and that then impacts our findings and how we think about products. I don't think it's just about it's not just about making sure that your surveys are representative, but also thinking about, are you incorporating that race and equity lens into how you ask questions and the questions that you ask, and how you then communicate your findings and the products that you use to communicate those findings. One of RAND's big missions is to inform the public. So if all of our reports are like 300-page technical reports that we post on our website, RAND is really good at that. We're really good at the 300-page report, but no one wants to read the 300-page report. So we're actually not getting our research into the hands of the people who need it, especially if they're people who don't have access to the internet and who may not have, for whatever reason, may have had to start working after high school. And then, so it's out of reach, it's not helpful. And so definitely thinking about the communication of our findings and how we get it into the hands of the people who actually need it and can learn from it has been a big focus, both of the Truth Decay work and then at RAND more generally.
Yeah, I will just add on to that, KFF, nonpartisan, non-advocacy organization, but we have always tried to tell the stories of disadvantaged populations and within healthcare and society writ large. And so, it's become harder, it's become more expensive to conduct representative surveys of these populations. But if anything, this has just recommitted ourselves to continuing to tell those stories and to do the work to make sure that those stories and experiences are communicated. As Jennifer said, the communication part of this is key, right? I think, myself as well as other members of the KFF team have found ourselves talking to different audiences than we did previously and before the pandemic, largely because we can do things like on Zoom, right? But also, just going out there and talking to different groups and making sure more people have access to our research and understand what we're doing and how we are here to help, right? So that's been a big part of this, and talking to diverse groups, not just kind of our usual policymaker groups.
I think getting back to that intersection of disinformation and public health polling, Ashley, the KFF disinformation vaccine monitor report that you put out, to me indicated that, correct me, tell me if I'm wrong on this, but it seems like there's kind of an implicit acknowledgement there that we know there's bad data out there, and not only are we putting out good information on vaccine awareness and who's getting their shots and all of that, but also we're putting out information to help the conversation around yes, this is where people are getting their information, and this is why there are some of these big differences in behaviors and actions as a follow-up.
Yeah, what we found is that it's really widespread. So, right, but belief in misinformation around the vaccines, or at least being unsure if it's true or not, is really more widespread than most populations and most groups think. It's majorities of people in the US either believe a piece of misinformation about the vaccines or unsure if it's true or not. And it's not just the people that are having malicious intent about spreading disinformation. It's really permeating to all aspects of this conversation. And so, yeah, that's, it's one of our poll findings, but it also helps inform our work, right? And the importance of getting good quality information out there. The sun is, sorry.
I just have to say that I'm jealous of the sun because I'm in DC and it's 4:40 and it's going to be dark in 10 minutes. So before this started, I had to go around my apartment and turn off every single light so that by the end, I wasn't sitting in complete blackness.
Don't worry, Liz and Molly have both tried to come and block the shade, and it's just not going to happen. So I'm just moving.
Maybe this is a chance for me to get to a question that I was going to ask about California versus the rest of the world, or PAPOR versus the rest of the country in terms of perspectives on how to poll on these issues. I think this is obviously the PAPOR conference. We have 2 Californians on the panel, and with both Jennifer and me in DC, 2 kind of East Coast bias people, unfortunately. Sorry, apologies for that. But I wanted to see kind of how do you think about the polling work that you've done, and specifically, the vaccine polling or the disinformation questions. How is that different, do you think, for everyone on the West Coast and PAPOR in general versus perspectives that others might have throughout the country?
Ashley, you want to go first?
Sure. So, so I'm in San Francisco today. You know, that's where KFF is headquarters. Living in Berkeley, California. I think what really, how it really impacts is thinking about the experiences that I'm having with my neighbors, and mask wearing is probably not representative of, and I know it's not representative of what we're seeing across the country. In terms of attitudes towards vaccines and masks, and you know, also the ability to work from home, right? It's not what is happening across the country. In many parts of the country, the pandemic was seen very differently and did not have huge disruptions to people's everyday life. And so when we're thinking about the questions that we're asking and how we can add to the public conversation, is really going beyond our own kind of individual experience and trying to understand what's happening with, you know, in rural communities and southern states. And so that's why, you know, really trying to get out of my California centric and my Berkeley centric life, and thinking more nationally about how we're coming up with the topics that we're asking about and attitudes and experiences.
Mhm. And I think we are a little bit of the opposite. We were talking about this earlier, because as we're looking at surveys that are being asked nationwide, we know our audience in liberal LA is not the same as the nation as a whole. So sometimes it's looking and saying, like, yes, if I was asking a question of the, you know, residents throughout the United States, I would ask it one way, but if I ask it that way in Los Angeles, I'm going to get all my findings in the 70, 80, 90% are all feeling one direction, and that's not helping. Sometimes that may be necessary, but in general, I don't want all of my questions to have that kind of a perspective, because we're trying to get at some of these nuances for what would be best for Angelenos. So sometimes we have challenges there. And also just thinking about topics such as climate change or the fires. These are not topics that others elsewhere in the country may be dealing with, as we're kind of looking to see, okay, so the fire is how many miles away? Where is, like, what's going on with the wind? You know, like, how far is that going to be? Like, can you drive there, or is that going to be cut off? And it's like, oh, that's just like, you know, fire season. You know, most people talk about, you know, snow or other aspects of seasons, and we talk about fire season. So there are just a lot of differences, I think, in the way that we're structuring our questions. And then thinking about how that information is going to be portrayed in the media. And then also what it's going to be like if I go to AAPOR and then I'm presenting on these topics, and people are like, where did these come from? Like, we're in Los Angeles, it's a little different. For better or for worse, things are a little bit different out here.
That's awesome. Thank you for sharing. I think I like still keeping connected with PAPOR, mainly because I think it gives me a way to see what's going on the West Coast, and I think there's so much interesting data coming out of California. I really enjoyed the session earlier with the California recall. So I think that there's so much interesting polling going on. So
I did used to live in LA actually for like 5 years, and then 4 years before that. So I've lived in LA for a bunch of times, and I agree, it is different. But you don't notice it until you leave and come back. And then you realize, wow, this place is weird.
It's true. Kind of last question before we wrap up. Let me know if anyone has any questions. We will have some time before we close. But just to kind of give everyone a last chance to run through some of their work from the year. You've all led research projects on very timely, sometimes hot button issues over the course of the past couple of years. You know, the focus of this session is on disinformation and public health. But if anyone has any stories that they'd like to share of either how their work led to real policy change, or an example of a specific piece of research that just like seemed to be like perfectly timed to the moment, love to give everyone the chance to kind of walk through some of their greatest hits.
Well, I want to just go before Jennifer's because hers is my favorite. So yours will overshadow one of our funny things I mentioned earlier about when Mayor Garcetti had asked about doing the survey. One of the fun things was we had the opportunity to do weekly briefings with his team. So I'm not used to doing weekly briefings with the mayor. One of them happened to be on my birthday, so having the mayor sing happy birthday to you was kind of fun. But at the end, they said a lot of the times he would use the results from the survey and the weekly briefings to then inform his press conference. And after the survey was complete, for the last one, his team had asked, like, can you write out what the list of the highlights would be? Like, sure, no problem. So I wrote them out and they said, and can you kind of like give some background and some context? So like, sure, no problem. He said, actually, could you come here and present the data? So I'm like, wait, like downtown, like in person? You want me to? This was in April after being a complete lockdown at the beginning. So I remember going to City Hall. It was the eeriest thing. It's in the it's very much during the day, but there's nobody around. Just walking through City Hall, I felt like I had this exclusive pass to kind of go wherever. But it was great. But I remember standing there and it's like, I don't know how far away, like that was at the beginning of trying to figure out like how far away is 6 feet? Like how are we like, hey, how's it going? But it was fun. And there was a temporarily trending hashtag, bring back the blonde, after the press release. So I'm getting made fun of by my colleague sitting next to me right now for saying that. But it was a fun opportunity and something that I will remember fondly and sillily, is that a word, for years to come.
So my story is actually from a couple of years ago, like pre-COVID, but when the Truth Decay report came out at the very beginning of 2018, and I think one of the reasons why I was able to be successful was that it did synthesize a lot of different strands of things people were talking about. People were talking about polarization and its impacts. They were talking about media literacy. They were talking about disinformation. There was a lot of focus on disinformation around the 2016 election and the role that Russia had played. And there was a lot of focus on kind of the tech space, Facebook, Twitter. And we were able to pull and kind of synthesize all of this into a framework that was easy to discuss. And I think that's why it was, successful, was that it just, it encapsulated what a lot of people were feeling and thinking. When I went to get a PhD in political science, did not expect to be writing anything that like lots of people would read. Most of my reports are read by like the sponsor and my parents and maybe 10 other people. And the Truth Decay report was kind of was very successful. And in June or July of that year, it was actually on President Obama's summer reading list. And that was kind of like a wild experience because that was like out of the realm of anything I had ever expected. And when I found out, I actually got like a whole bunch of text messages at once from people telling me this, and I almost fell down a flight of stairs, which is like the only thing I remember about it was like looking down and almost falling down this huge flight of stairs because I was just so shocked. But anyway, I think it was at RAND, we do research, we try to inform policymakers, and this was just a really great example of a way in which being in the right place at the right time and being able to summarize things sort of concisely and succinctly was able to kind of catch the attention and kind of catch on in a way that a lot of things, most of my other work hasn't. And so that was really a great experience to kind of be kind of at the center of a larger dialogue.
Yeah, President Obama, I'm sure, has never read anything that I've written, but I think we're all like experiencing new things, and in terms of like putting out really timely research and conducting interviews in like sweatpants from the waist down and nice shirts and understanding how. But I think, you know, one of the things that I will remember forever is my wife and I had to drive it. We rented a camper van to drive across the country. We had to go visit her family for a family emergency. And I remember doing calls with reporters sitting in a camper van in like the middle of like an RV resort in like Kansas, and like talking about vaccine and attitudes. And my wife, like, now she can give the interview for me. She knows exactly what to say, what all the talking points are. So yeah, that's one of my most memorable experiences. Sure.
That's amazing. I'm sure there are people's family members in the background right now, to be honest, in a lot of these phone calls. So thank you to everyone for joining, and thank you to your partners and children and dogs and cats for attending as well. It's been really, really nice to see everyone. Does anyone have any questions for our panelists? We had a great conversation, and I'm really, really glad that everyone was able to share so many stories about all of the fun things that they've done the past couple of years.
I've got one in the chat, so you don't have to toggle back and forth, Laura.
Thank you.
Francine asks, how do we break the cycle of misinformation that polarizes Americans on both sides? So real easy question. I say in jest.
Jennifer, that is all you.
All right, so I'll start. So I mean, obviously the question of solutions is like super hard. And so in the first book, we just punted on it completely. And we're like, we need more research. Here's a bunch of additional questions to ask, which is a very Rand thing to do. The solution to all the problems that we've identified is to do more research. Since then, I think we've tried to identify, if not like the specific policy solutions that are required, think about like what are the spaces where we think solutions exist, and focus digging in on those areas so we can understand them better and identify the specific tools that are likely to work. So one area I think that's worth focusing on is obviously education, media literacy, civic literacy. There's emerging research that suggests that when you teach people, not just it's not just about how to read the news, but it's about understanding the nature of information. It includes science literacy and math and statistics and the ability to synthesize from lots of sources and understand context. So it's a very nuanced set of skills. It's not just like kind of a checklist. That those types of skills are helpful, that they do help people to identify disinformation. When people are primed to understand, hey, Russia's trying to mess with your head, this is what Russian disinformation looks like and does, they are better at detecting disinformation when it passes through their feed. The challenge though is scaling that. We can reach students in schools, but unfortunately some types of media and civic literacy have now become sort of politicized. Which means that they've, are being squeezed out. But how do you reach everybody else? Like, how do you reach adults? How do you reach underserved communities? How do you provide resources to teachers who are already totally overworked and don't even have the resources to teach kind of the core set of subjects? So that's one set of questions, but there's definitely an emphasis on making sure that we get this type of education into schools and into to reach other populations, adults included, is really important. That's sort of like the demand side. On the supply side, I think there are things that the media could do to help readers and consumers of information. That might include thinking about how even mainstream newspapers can do a better job of disentangling fact and opinion. Right now, everything is usually presented as kind of a muddled mess, and that makes it really hard. So how do we disentangle facts and opinion? Can we do a better job of labeling them? Can we split off the editorial and the kind of analysis piece entirely, like it used to be in papers where they were really very separate and even had separate columnists? Maybe we need to rethink the role, all newspaper reporters now have Twitter feeds where they share their opinions. Does that mess with the consumption? So there's something about how we consume this factual information. And then obviously the social media space is a big one. We know that even though this is not a social media problem only, social media plays a huge role in amplifying disinformation. So one set of questions that we're focused on at RAND is thinking about social media governance. What does that look like? Obviously, in the US, we have the First Amendment, which protects which protects speech and makes it difficult to have the government involved in any sort of content moderation. But there are a whole range of other types of things that we could do on social media platforms. Things like thinking about who has access. Should anonymity be allowed? Should bots be allowed? Ways that we might change the advertising framework. Those are types of things that we might be able to do that would limit or reduce the spread of disinformation. But that's a space, dealing with the future of social media, I think is a huge place for additional focus. And unfortunately, right now that discussion typically falls into either we regulate everything or we do nothing. But there's a huge gray space there. And so I'd like to see more focus there.
I think, yeah. I mean, Erin was joking earlier about how there's not a solution for it, but Jennifer, I feel like you've laid out a strong path forward from all of that. So, Erin, I see a couple more questions here in the chat. Let me read a couple of them. First, Austin is asking, has the prevalence and sentiment around anti-vaccine attitudes and public health disinformation been looked at specifically in rural communities versus urban communities? Ashley, I think that might be best for you.
Yeah, we have been looking at individuals that live in rural areas to understand attitudes towards vaccine. We were also interested about access to the vaccines early on to understand how availability was in those populations. It's really, it's shifted slightly over time. There was a time where rural communities were actually having a higher vaccine uptake because they had it more easily accessible than urban communities. But that has definitely steadied off. And, but the regressions that we run, it really is driven largely by partisanship. So those that are living in rural communities tend to be more conservative, Republican leaning. And so that seems to be what driving a vaccine intent in those communities. But yeah, we actually are going to do another rural report probably out the next couple of weeks. So keep an eye out for that.
Awesome. And then one more question, Jennifer, I think this might come back to you. Have you polled and researched the Russian-speaking community in the US separately? This diaspora tends to feed off of propaganda on both sides, and they are in a way a bridge for disinformation and may tend to be very active in general communities and in social media. Any idea about, different communities or different languages, maybe different, what would that be? Populations that speak non-English languages as a source of disinformation?
So we do, RAND does have Spanish language surveys, but that has not been a focus of the truth decay research, disentangling Spanish versus English language, which is definitely a limitation of our work thus far. We haven't looked specifically at polling the Russian-speaking population, although we have, we have looked at Russian-speaking communities, but focused mostly in the Baltics. So looking at disinformation in the Baltic states and trying to look at some of the narratives that spread there and how Russia operates and the extent to which we can link accounts and identify patterns. So accounts that seem separate but are actually coordinated. I'm happy to send a link to that report, but we haven't done any focus in the US yet, but it's a really good point, and I'm gonna take that idea back to the team.
And then let's make this the last question. What can researchers do to make findings more accessible to the public? Disinformation is often simpler, easier to understand, and more compelling. How can high quality research compete with that? And should it be up to researchers to ensure that the truth gets out broadly? That is from Gina. That's an excellent question to end on.
I'm going to talk about polling a little bit rather than just research generally. I think the commitment to transparency, I think, is really important. Talking about, our methods, what we know and what we don't know in our data, I think, is really important, and not hiding any of the things that we don't know, really being honest about what our polling shows. And, I think that is an important part of the work that we're doing, is really that in our data. And so that could probably be translated to research writ large, but yeah, that's what we're committed to.
I know for us, Jennifer, thinking about your comment about the 300-page report, how do we, how do we synthesize those? The same thing. It's like, I mean, we have a ton of tables of really interesting data, but trying to synthesize and simplify those into reports. Even just taking something as simple as, I mean, almost all of our reports before were vertical because they were printed and people looked at them, and now taking so many of our files and our reports and making them horizontal, because if people are looking at them on a screen, how can they digest that information in a little bit different way? And we've put a lot of emphasis on the clarity, that we're not trying to do charts and graphs that have, as much information as possible, but how can everyone else who's looking at our data see the main takeaways as clearly and quickly as possible, in the hopes that they would feel very comfortable, like, oh, I'd like to engage, I'd like to see more of the research that's out there, as opposed to I don't quite understand what I'm supposed to be finding from this chart and graph. So what colors are we using? How clear are the fonts? And it seems like a simple thing, but we have somebody who's specifically kind of dedicated to that craft.
Awesome.
Yeah, so like Bri, I think it's definitely been a focus of thinking about how, like, the types of products we use. So we've been, in addition to like our longer reports, trying to do digital products, so like digital articles that take our key findings and like weave them into stories that are a little bit easier to digest. Thinking about graphs and making sure that we're clear, moving away from having regression tables and reports at all, move them to the appendix. That's where the anybody who really cares can look at them there. But this question of like, should it be up to researchers? I think it's hard because the way we're trained in, especially if you have a PhD or a master's degree, the way you're trained to be a researcher doesn't prepare you to communicate very well with the general public. I mean, the style of academic journals is not accessible to the general public. It's a totally different way of communicating. So I think that, ultimately researchers do need to play a big role. But I do think that there needs to be more of a focus on thinking about how we make that jump. There are organizations that at least try to bridge, at least in political science, like the Bridge the Gap program to bridge between academia and policy, but that still doesn't bridge the gap between academia and the general public. And so thinking about, how do we train researchers in grad school to do that? And then what resources are available for those of us who are now out of grad school, so that we can gain those skills and continue to improve ourselves, I think is a really important challenge, not just for public opinion researchers, but for all of academia.
Absolutely. Okay, with that, we will close the plenary session. Thank you to our three panelists. You've been excellent guests and experts, and you've shared your wisdom. Thank you so much. Thank you to everyone who's joined, and thank you also for your great questions and comments throughout.